Well, today we invited a friend from UF Health Jacksonville to talk about heart disease and heart surgery. So please welcome Dr. Thomas Zeil. Thank you so much for joining us.
Thank you so much for having me.
Of course.
Appreciate being here. So.
Yeah, very important stuff we're going to be talking about today. But first, let's get into the difference between a cardiologist, and I want to make sure I get this right, and a cardiothoracic surgeon.
Yes, that's correct. So a cardiothoracic surgeon is going to be somebody that deals with the surgical aspects of heart disease. And so when we're thinking of that, we're thinking of people who have coronary artery disease, heart valve disease, and a surgeon is going to be someone who can be able to surgically fix that versus a cardiologist tends to treat that with medicine.
Oh, okay. So why should a patient then choose UF Health Jacksonville for their heart health?
Sure. So, you know, because we're creating a state-of-the-art program, we've been doing some more complex surgery. We've been doing advanced aortic surgery. And I think the thing that we've sort of kind of focused on in the past is sort of blood utilization, and we've been able to come to utilizing about half the amount of what the national average is. And that allows us to offer surgeries for people who may not want to have blood products given for religious reasons.
Oh, interesting. And that's something I probably would have never even thought of. So that's really cool that you have thought of that, or y'all have thought of that. And you mentioned advances. So what are some of the latest advances in heart surgery?
So advances, you know, technology's been great and has been improving over the years. Advances are going to be things such as minimally invasive surgery, robotic surgery, and something that's called transcatheter surgery. And those surgeries have allowed patients to have decreased hospital stays, decreased pain with the surgery, and usually be able to get back to their activities of daily living a little bit faster.
Yeah, who doesn't want that, right?
Correct.
And of course, heart disease, unfortunately, is pretty common in the U.S. How is it treated, though?
So, you know, unfortunately, about one person in every 33 seconds, you know, will succumb to heart disease.
Really?
Yeah, so it's very rampant, and so, you know, the way that we treat it then is through surgical means and by doing open heart surgery. But again, like I said, some of these surgeries may not be really relevant for everybody, and so you know, we definitely risk stratify those patients and make sure that we're doing appropriate things and work with our interventional cardiologist and our cardiology team. Okay,
I've heard Afib. You hear that? Is it an acronym? I don't even know. I hear that a lot, but I don't exactly know what it is. So can you explain what it is and how that's treated?
Sure. So Afib, otherwise known as atrial fibrillation, is an electrical problem of the heart where the lub and the dub are not talking to each other, and what you'll get is electrical impulses that will create a heart that's not beating, and what you can get is you can get blood clot there, and so you can get stroke. So most of the time that's treated initially with medicines, but sometimes if you're a surgical patient, we'll go in and we'll have the ability to use ablation techniques in order to try to prevent you from going into Afib afterwards, as well as excluding a little part of the heart that has the propensity to get blood clot, so that in the future you wouldn't have to necessarily be on blood thinner, for which most of the population is on for atrial fibrillation.
And is this related with heart palpitations?
Yes,
did you mention? Okay,
definitely.
If someone is having heart issues though and they want to make an appointment with UF Health Jacksonville, what is the best way they can find you?
So just to go online and find our information on the internet on our website. We have campuses obviously at the North Campus by the airport, or downtown campus, and now our Deerwood, where we're seeing patients in consultation.
Well, thank you so much for joining us today. I feel like I learned a lot. That's what's so cool about this show, right? We entertain you, but we also learn about some really important stuff here. And thank you for what you do as well, Doctor.
Thank you. Thanks for having me.
All right, let's toss it over to David.